All right, so listeners, we've got this medical case study,
Oh, cool.
and it's a real head scratcher.
Interesting.
It's about hereditary spherocytosis,
Okay.
which is this condition that affects red blood cells.
Mm-hmm.
So it's kind of like we're going to be going behind the scenes
Yeah.
of your blood and figuring out like what makes it tick,
Nice.
or in this case, what makes it like not tick so well.
Yeah, so it's kind of like a detective story, right? So
Hmm.
we're going to be piecing together these clues
Yeah.
to kind of figure out what's going on.
Yeah, and the first clue we have
What's that?
is that our patient has these interesting scars.
Oh, wow.
So one of the scars suggests that she had her spleen removed,
Oh, wow.
which is a pretty big deal.
Yeah, that's a major surgery.
And then another scar hints that she might have had her
Huh?
gallbladder removed, too.
So those scars are they're huge.
Yep.
They're like flashing neon signs telling us that
Right,
this
yeah.
patient's medical history is not ordinary. And then when you consider that she mentioned struggling with fatigue,
Oh, right.
it all points towards hereditary spherocytosis.
Okay, so we have some clues. We're trying to put together
Yeah.
the pieces.
Right.
But what is hereditary spherocytosis? Like, what's
Yeah.
going on there?
It all boils down to your genes,
Okay.
those blueprints that make you use.
Yeah.
And so in this case, there's like a glitch in one of the genes
Okay.
that's responsible for building red blood cells.
Right.
And instead of the usual like disc shape that you see in red blood cells,
Mm-hmm.
they end up looking like tiny spheres.
So they're like going through an identity crisis shape-wise?
Exactly.
Uh-huh.
But it's not just a cosmetic issue.
Right.
These spherical cells are more fragile
Right.
and they break down easily.
Gotcha.
And this causes a shortage of red blood cells, which we call anemia.
Oh, so that explains the fatigue.
Yeah.
It's like her body's struggling to get enough oxygen
Exactly. It's not getting enough of those healthy red blood cells.
because of these like wonky shaped red blood cells.
Exactly.
So what else happens when you have this condition?
Well, along with the anemia,
Okay.
you'll often see jaundice,
Ooh.
which is that yellowish tint to the skin and eyes.
Yeah.
And that's caused by a buildup of bilirubin,
Okay.
which is a byproduct of those breaking down blood cells.
Oh, I see.
And then the spleen,
Mm-hmm.
which normally filters out the old blood cells,
Right.
it gets overworked
Yeah.
and enlarged trying to keep up with this.
So it's like a domino effect. One
Yeah.
problem leading to another.
Exactly.
But hold on. If these fragile red blood cells are
Mhm.
breaking down all the time,
Yeah.
wouldn't that be
It
dangerous?
can be, yeah.
What kind of complications can happen?
You're absolutely right to be concerned.
Yeah.
One of the biggest worries is anaplastic crisis.
Mm-hmm.
So it's kind of like the factory that makes your red blood cells just
Right.
suddenly shuts down.
Wow.
And this is often triggered by an infection, and this can be life-threatening if it's not caught quickly.
Yikes. Okay. What else?
Well, there's the ongoing struggle with anemia,
Right.
which sometimes requires regular blood transfusions.
Okay.
And then there's also an increased risk of gallstones.
Gallstones. Wait.
Yeah.
Didn't one of our patient's scars
Yeah.
potentially come from gallbladder removal?
Uh-huh.
Are you saying that those gallstones were a result of her
It's very possible.
hereditary spherocytosis?
It's a common complication.
Wow.
So we're starting to see a clearer picture
Yeah.
of our patient's journey.
Right.
She had a splenectomy, probably because of severe anemia.
Okay.
And then she might have also had her gallbladder removed
Yeah.
because of gallstones. And it all stems from this
Oh,
one genetic quirk.
Okay. So we know some of the consequences now.
Yeah.
But how do doctors even figure out if someone has hereditary spherocytosis?
It does involve some detective work.
Yeah.
So doctors will start with a blood test,
Okay.
but not just any blood test. They're looking for specific clues,
Mhm.
like the number of young red blood cells
Okay.
and how much hemoglobin is packed in each cell.
Interesting.
It's like analyzing the blood's fingerprint.
Fascinating. I never knew there were so many ways to read a blood test.
Lots of information in there.
So they're looking for these specific markers in the blood.
Uh-huh.
What else are they doing?
They'll actually look at the blood under a microscope,
Oh, wow.
looking for those spherical red blood cells.
Mm-hmm.
And they might also run some tests to measure levels of certain substances
Okay.
that spike when red blood cells are breaking down too quickly.
So it's like a multi-pronged approach.
Yeah.
Using all these different tools to put the
yeah.
puzzle together.
Mm-hmm.
But how can they be sure it's hereditary spherocytosis and not some other
That's a great question.
blood condition?
So they have ways to rule out other suspects,
Yeah.
like immune-mediated hemolysis,
Okay.
where the body's own immune system is attacking red blood cells. There are specific tests for that.
Okay, so diagnosis is this pretty thorough process.
It is.
But what about treatment?
Yeah.
What can they do once they know someone has hereditary spherocytosis?
Well, it depends on the severity of the condition.
Okay.
Sometimes simple folic acid supplements
Mm-hmm.
can make a big difference.
Oh, interesting.
But in more serious cases,
Yeah.
we might need to consider other options,
Right.
like blood transfusions to combat anemia.
And remember that splenectomy we talked about?
Yeah.
That seems like a pretty drastic step.
Yeah.
Why would you remove a whole organ?
Well, this is where things get really interesting.
Okay.
Yeah.
So tell me, why is removing the spleen sometimes the best option?
Well, the spleen is kind of like a quality control checkpoint for
Right.
red blood cells. It
Yeah.
filters out the old, the damaged, the
Yeah.
spherical ones.
Right. So,
And in hereditary spherocytosis,
yeah.
those misshapen cells are like sitting ducks. They get
Huh.
caught in the spleen's net and destroyed.
Wow. So it's like the spleen is working against the body.
You could say that.
In
Yeah.
this case,
Yeah.
removing it seems counterintuitive,
Uh-huh.
but I guess it makes sense if it's like the main source of
Right.
destruction for these red blood cells.
That's a great way to put it.
Uh-huh.
Removing the spleen can really reduce how fast
Yeah.
those fragile red blood cells are destroyed,
Okay.
giving the body a chance to,
Yeah.
catch up and produce more healthy cells.
So it's not just about treating the symptoms.
Right.
It's about addressing the root cause.
Exactly.
But I have to ask, what about the long-term consequences?
Yeah.
Isn't the spleen important for immunity?
That's a really good point.
Yeah.
The spleen plays a vital role
Yeah.
in fighting off certain types of bacteria.
Okay.
So when it's removed,
Yeah.
patients are more susceptible to infections,
Right.
especially from what we call encapsulated bacteria.
So it's a trade-off.
It is, yeah.
You gain better control of the anemia, but increase the risk of infections.
Right.
That's a tough decision.
It definitely requires careful consideration
Yeah.
and a personalized approach.
Mm-hmm.
So patients who undergo splenectomy
Oh, yeah?
need to be up to date on their vaccinations
Right.
and seek prompt medical attention
Yeah.
if they show any signs of infection.
Gotcha.
It's all about managing those risks and benefits.
It sounds like ongoing care and monitoring is
Oh, absolutely.
crucial after splenectomy.
Yeah.
But tell me, with all the amazing advancements in medicine,
Mm.
are there any less invasive alternatives on the horizon?
That's where the field gets really exciting.
Okay.
Yeah. One of the most promising areas of research is gene therapy.
Gene therapy.
Yeah.
Hold on, are we talking about like actually rewriting
Yeah.
someone's genetic code?
Pretty much, yeah.
That sounds like science fiction.
It does, doesn't it?
Yeah.
But it's becoming a reality.
Wow.
So in gene therapy,
Mhm.
scientists can deliver a healthy copy of the gene right into the patient's cells.
Hmm.
It's like replacing a broken part in a machine.
Okay, now that's what I call innovative.
Uh-huh.
So what's the status of gene therapy for hereditary spherocytosis?
Well, it's still in clinical trials,
Okay.
but the early results are encouraging.
Oh, that's great.
There's still a long way to go,
Mm-hmm.
but it has the potential to revolutionize
Yeah,
how we treat this condition.
that's amazing news.
Yeah.
What about for those who need help right now?
Yeah, that's a good point.
Are there any non-surgical treatments?
There are some exciting developments there.
Oh, okay.
Yeah. For example, researchers are developing drugs
Okay.
that can stabilize the red blood cell membrane,
Okay.
so making those spherical cells more resilient
Gotcha.
and less prone to breaking down.
So instead of removing the spleen, you're just giving
Exactly.
those red blood cells a little extra support.
Yeah, much gentler approach.
Right. That seems a lot better
Yeah.
than
Yeah.
like
Right.
major surgery.
And it's a more targeted approach,
Yeah,
focusing on that root cause.
that's good.
These drugs are still being tested,
Okay.
but they hold a lot of promise
Yeah.
for improving people's lives.
I'm curious, though, are there any downsides to these new approaches?
That's a great question. And,
Yeah.
like any new medical treatment,
Yeah.
there are always risks and benefits.
Right.
We have to weigh those.
Mm-hmm.
Gene therapy, while promising,
Yeah.
is still relatively new.
Okay.
So we need to be cautious
Right.
about the long-term effect.
So it's a balancing act,
It is.
weighing the potential benefits against the unknowns.
Exactly.
Yeah.
And that's why rigorous testing
Mm-hmm.
and long-term monitoring are so important
Right.
for any new treatment.
Yeah.
Safety is paramount,
Of course.
but the rewards are immense.
Yeah,
Imagine a world where this could be cured with just one treatment.
that would be amazing.
It would.
But let's bring it back to our patient for a second. We've talked about splenectomy, but are there any other clues
Hmm.
from her case that might tell us more about her journey?
Well, we know she might have had a cholecystectomy,
Right.
which, as we discussed, is a common
Yeah.
complication of hereditary spherocytosis.
Yeah.
This suggests she might have had more severe symptoms,
Okay.
leading to that decision to remove her spleen.
It must have been a difficult journey for her,
Yeah, I imagine so.
navigating the challenges and
Yeah.
going through major surgeries.
Absolutely. It highlights the importance of early diagnosis and management.
Right.
The sooner we identify and address this,
Yeah.
the better the chances of preventing those complications.
I'm curious, though. We know our patient had fatigue,
Uh-huh.
but did she ever mention any of the other symptoms,
Right.
like the jaundice or enlarged spleen?
Unfortunately, our case study doesn't give us those details,
Oh,
but it is a good reminder that
Yeah.
not every patient presents the same way.
right.
Sometimes the symptoms are subtle, and it takes a keen eye and some detective work to connect the dots.
So it's not always a clear-cut diagnosis.
It's not always, no.
That's why it's important for healthcare providers
Yeah,
to be aware of this.
right, to consider.
Consider it as a possibility,
Absolutely.
especially with unexplained anemia.
Yeah.
It's a reminder that medicine is as much an art as it is a science.
I like
It
that.
requires that careful observation
Mm-hmm.
and critical thinking
Yeah.
and willingness to consider everything,
Exactly.
all the
You
possibilities.
hit the nail on the head.
And it also underscores the importance of patient advocacy.
Yes.
The more patients know about their condition
Mm-hmm.
and treatment options,
Yeah,
the better equipped they are to advocate for themselves.
absolutely.
Yeah.
And get the best care.
Speaking of treatment, I'm curious about the psychological impact
Yeah,
of living with a chronic condition
that's an important aspect.
like hereditary spherocytosis. I imagine it can be pretty challenging,
It can be, yeah.
physically and emotionally.
You're right. It's important to remember
Yeah,
that behind every case study is a person
right.
with real emotions.
Yeah,
You know, living with a chronic condition can be tough.
yeah.
Ups and downs, good times and bad times.
It must take a lot of resilience to navigate that.
It does, and that's where support systems come in.
Yeah, like family and friends.
Exactly. Family, friends, support groups,
Mm-hmm.
sharing experiences, connecting with others
Yeah.
can make all the difference.
It's a reminder that healthcare isn't just about treating the symptoms.
Right.
It's about addressing the whole person,
The whole person.
their emotional and social well-being, too.
Absolutely. It highlights the importance of
Yeah.
holistic care.
Right, where the doctors and patients
Yeah, everyone works together.
work together
Mhm.
to create the best treatment plan.
Exactly.
This has been such an eye-opening conversation.
It has.
We've learned so much about hereditary spherocytosis,
Yeah, it's a fascinating condition.
from the genetics to like the research on
Fascinating.
all these new treatments.
It's incredible.
But I have one final question.
Okay.
Do we know what happened to our patient?
Yeah, good question.
Like, did the splenectomy give her the relief she needed?
Well, unfortunately, the case study doesn't tell us that.
Oh,
But we can hope that by removing the spleen,
yeah,
her anemia improved.
right.
And she had more energy.
That's what I'm hoping for.
Yeah.
It's a reminder that behind every case study
Mm-hmm.
is a story of resilience
It is.
and hope,
Yeah.
a testament to the human spirit
Beautifully said.
overcoming these challenges.
You know, and remember, this
Yeah.
is just the beginning of your exploration.
Oh.
We've given you the knowledge.
Yeah.
But now it's up to you to
Right.
keep asking those questions,
Yeah.
to delve deeper,
Wow.
become an informed advocate for
Yeah.
yourself or others.
Exactly. Our deep dive may be over,
Right.
but your journey of discovery
Yeah.
is just beginning.
Keep learning.
Keep those questions coming. Keep exploring. Keep learning.
Exactly.
Who knows?
Yeah.
You might be the one to make the next groundbreaking discovery.
You never know.
You know, it's pretty amazing how far we've come with treating hereditary spherocytosis.
It really is.
But, like we talked about,
Yeah.
splenectomy has those long-term risks.
Right. Definitely something to consider.
It makes you wonder, like, what's next?
It's a great question.
What else is out there for treating this condition?
Well, the search for less invasive treatments,
Mhm.
you know, that's a hot topic in research right now.
Okay.
We're really trying to address the root cause,
Right.
those faulty
So gene therapy, right?
Exactly.
That's what we talked about earlier, is that
Yeah.
the holy grail here.
You could say that.
Are we talking about actually fixing the genes?
Yeah, pretty much.
Wow.
So gene therapy delivers a healthy copy of the gene
Right.
directly into the patient's cells.
So it's literally correcting the blueprint.
Yeah, it's like swapping out a faulty part in a machine.
That's pretty wild.
It is, isn't it?
What's the timeline on that? Is
Well,
that something that could be available soon?
it's not quite ready yet,
Okay.
but the early clinical trials are looking really good.
Oh, that's good.
And it's possible
Yeah.
that in the future, maybe not too distant future, a
Right.
single treatment could cure this.
That would be incredible.
It would.
What about right now?
Yeah.
Are there any other non-surgical options?
There are some really cool things being developed.
Oh, okay.
One I find really interesting is stabilizing the red blood cell membrane.
Okay.
So researchers are trying to make those spherical cells more resilient.
So it's like giving them a little armor.
Uh-huh. Exactly.
Ah.
Protecting them from damage.
So how do they do that?
They're developing drugs that target specific proteins in the red blood cell membrane
Gotcha.
to strengthen and support it.
Wow. It's amazing how targeted treatments are becoming.
It really is.
Are there any other promising avenues being explored?
There's another one that's pretty neat.
Okay.
It involves stimulating the production of healthy red blood cells.
So like boosting the body's own ability
Exactly.
to make up for the loss.
Yep. Researchers are looking at ways
Wow.
to stimulate the bone marrow,
Okay.
which is where red blood cells are made,
Right.
to increase production.
Mm,
So this could potentially reduce the need for transfusions.
that'd be great.
Yeah, giving patients a more natural way
Right.
to manage the anemia.
It's really incredible, all these new approaches.
I think so too.
It seems like we're on the verge of a whole new era
I agree.
in treating hereditary spherocytosis.
Absolutely. And it's not just about new treatments.
Yeah.
It's about understanding the condition better.
Right.
Researchers are digging deeper into the genetics,
Like-
different subtypes,
Yeah.
how it affects different people.
It's amazing how much we still have to learn,
I know, right?
even with something we've been studying for so long.
It shows you how dynamic medical science really is.
Absolutely.
And with all the advancements and the collaboration between researchers,
Right.
I'm really optimistic about future breakthroughs
That's great.
for helping people with this condition.
Well, this deep dive has been quite a journey.
It has.
We've covered so much.
Yeah, we really have.
It's been so interesting and thought-provoking.
I'm glad you found it valuable.
I really have.
And remember, this is just the start.
Yeah.
You know, we've given you the basics,
Right.
but there's so much more out there to explore.
Yeah, keep those questions coming.
Exactly.
Keep learning, keep researching.
Just keep that curiosity alive.
You never know what you might discover.
You never know.
Thanks for joining us on this deep dive
It's been a pleasure.
into the world of hereditary spherocytosis.